Hi, welcome to Money Confidence. I'm Crystal Oculee. I'm the Chief Financial Strategist here at Confidence Wealth, and every week I try to bring a topic that's talked about. So, topic this week that a lot of attention came to has been long-term care needs. I have some clients that are, in a sense, sandwich generation, taking care of their elderly parents, and then they also have their children. So they were talking to me about the cost of long-term care and how it's depleting a lot of the assets of their parents that they did not expect. So this is something that a lot of people get confused about because they believe Medicare or healthcare really fulfills the need for long-term care. And unfortunately, that's not the case. So statistically speaking, as we age and we get older, there are things that, happen, such as just think about you slowing down. And if you can't perform 2 out of 6 daily activities, which are going to really, that's what defines you, that you are no longer able to perform these activities on your own, and now you need long-term care. So now, if the long-term care needs last about a year, maybe it's towards the end of life, and that happens, that doesn't really drastically make a huge impact. What is scary is when it's catastrophic. So for example, the long-term care needs can take longer than your average 2 years. What if it's 5 years? What if it's 10 years? So when you think about dementia, Alzheimer, things like that, or if someone, say God forbid, broke a hip, now they're handicapped and they have a wheelchair and they're older, those are the things that sometimes really ends up causing that's catastrophic. And catastrophic can be pretty scary because that can deplete all assets, because the cost of that care can be, depending on what state you're in and what kind of help you have, and if there's no family that can help you, that cost can be really, really huge. In some cases, it could cost $100,000, some cases $150,000, in some cases $200,000 per year for the care. Could even go higher than that, right? Depending on the facility or the 24-hour care that's needed. So it really is important to understand that. And the reason is that a lot of people that are planning their retirement, what's the first thing you think about? I don't want to run out of money. I want to make sure I spend my lifestyle. And in some cases, I want to be able to leave money behind. So if leaving money behind is important to you, you really have to be careful and see, do I have other assets or possibly insurance to replace, right, what is going to be needed if I spend this money down? Do I have long-term care insurance to cover that? Does it even make sense to get long-term care insurance depending on your age? Do you even qualify for it? So these are the things to really think about. And in some cases, sometimes people have a tendency to not want to spend so much because they're afraid that this long-term care needs can occur. So they're afraid, even if there is no kids, they're afraid to spend more than they want to because of the need of, God forbid, this long-term care issue that may show up in the future. So there are ways you can work around that to find out, what do I need to do to secure that there is a good plan in place to take care of me should a catastrophic long-term care arises, and then what's the maximum money I can spend without worrying about that and running out of money. And the reason I bring this up is that most people ignore this till the problem rises. Most people don't want to talk about what if something happens to me and I'm no longer here. Most people don't want to talk about what if I need long-term care needs when I'm in my 90s. But the more you think about these things, the better the plan you will have in place. I want you to think about yourself as a business. If a business wants to stay, so let's say you're a restaurant and you want to stay in business, you want to come up with things that can happen. Like, what if, God forbid? So think about restaurants when the pandemic happened. The restaurants that had emergency money aside and were able to sustain themselves through catastrophic were able to make it through. Restaurants that were not, that they were just working paycheck to paycheck and whatever was, the cash flow was there and it got depleted, unfortunately went out of business. So think about your personal plan like you're a business. So you have to think about catastrophic things that can happen. In this case, the catastrophic thing could be, what if I'm my 90s or my late 80s and I need long-term care needs, that is going to take more than 5 years to cover. What is my plan? What do I have in place? And then test for it. Run different scenarios. So if you're listening to this and you're like, Crystal, I know I talked to this about my team, but I'm not really clear. I really want to rerun the numbers, look at things a little bit more with a magnifying glass in a sense, and rerun numbers, please feel free to reach out to your team. If you've never talked about it, this is even more important why you should address it today. If you are friends or family of our clients and you're listening and you're like, you know what, no one's even ever talked to me about this, feel free to reach out and we can test that for you as well, because these are the services that we do provide to our clients, friends, and family as well. In the meantime, if there's anything that you need or any subject you like to talk about, please don't hesitate to reach out and let me know so that can be the subject of next week. Talk to you soon. Have a good one.